Hey, good afternoon, all. Can you please confirm whether my voice is clear?
Yes, yes, you are audible.
Yes, sir.
Thank you.
Yes, sir, your voice is audible. Request all participants to kindly mute your. A very good afternoon to one and all present here. I, Tina Chelani, on behalf of KD Institute of Nursing Sciences, would like to welcome you all for joining us today for international webinar on nursing informatics. We are truly delighted. Good afternoon, all. Am I audible?
Yes, ma'am.
Good afternoon, everyone. I, Tina Chelani, on behalf of KD Institute of Nursing Sciences, would like to welcome you all for joining this session. We are truly delighted to bring together expert and participants So it's an our honor and privilege to host our very special guest today, Mr. Sajid Thomas, sir, clinical nurse specialist, informatics nurse at Al Qasami Hospital, UAE, with over 13 years of experience in critical care, nursing education, and healthcare facilities. Sajid sir is a recognized expert in the field. He is also a certified professional in health information with
It's
specialized
audible?
expertise in clinical informatics, electronic medical record, data analytics, project
Maybe
management.
Esther also have to listen. Okay.
Instrumental in aligning informatics infrastructure with the organizational goals, thereby enhancing patient care quality and improving operational efficiency in healthcare delivery system. To officially begin this enriching session, I would request Dr. Chris Thomas, sir, Principal, KD Institute of Nursing Sciences, to deliver keynote address. Over to you, sir.
Very warm good afternoon, everyone. May I request to Miss Arunmuri, can you please mute yourself? We apologize for being delayed for 15 minutes. First of all, good afternoon, everyone. It gives me immense pleasure to welcome you all for this enriching webinar on nursing informatics, an area that is becoming increasingly vital in modern healthcare and nursing practice. As per our Indian Nursing Council syllabus, this subject is not now just an academic requirement, but a real world necessity for every 21st century nurse. So, in today's healthcare environment where data, technology, and patient centered intersect, nursing informatics empowers nurses to contribute effectively to clinical decision making, improve patient outcomes, and enhance healthcare efficiency. As the principal of KD Institute of Nursing Science, I strongly believe that it is our responsibility to prepare our students not only with traditional nursing skills but also to equip them with digital literacy and informatics competently. So now I take pride in introducing our distinguished speaker, though we have a formal introduction. Though Mr. Thomas Kuti Saji, though we have known each other in digital space, but I can say he has been more than just a professional contact. He's been a knowledgeable peer and a good friend of mine. So he is practicing nursing informatics whose work blend the art of nursing with science of technology. So he will guide us through the core of concepts of nursing informatics, its practical applications, and we can align like academic and clinical practices to these new paradigms. So I request all the participants, delegates, and their students to be attentive and interactive, as this is a wonderful opportunity to learn directly from someone who is in this field. I wish everyone a productive and fruitful session. Thank you.
Thank you, sir. We are fortunate to have Mr. Sajid Thomas, sir, with us today to lead this session. His extensive background and hands-on experience in the integration on nursing practice and technology will be truly helpful to us throughout this session. I would request sir to kindly commence the session.
Hey, good afternoon, everyone. I hope I'm audible to you all. And thank you so much for the kind introduction. And thank you, Dr. Chris, for the great introduction. As he told, actually, we are good professional mates and also very good friends. And my humble thanks to all the one who just be here as a professors, as a doctors over here in this platform and to my dear future nurses, future colleagues, those who are sitting over here. And when I just see your class over there, actually, that takes me to a decade back where I just sit in that place. So we can just start our session today. It's a nursing informatics. As he told, actually, I'm currently working as a nurse informatician in the United Arab Emirates. Before starting a session, I just want a very key to know what do you think about a nurse informatician in healthcare? It's a question for my future nurses. Anyone? It's just a curiosity. Are you ever see a nurse informatician in the healthcare field? Do you get any chance to chat with a nurse informatician? So what do you think about that? Anyone can respond. I am looking forward for a very interactive session. So where my aim is to understand properly what nurse informatics means after this session. So what's your idea? What is that? What is nurse informatics in the field of healthcare? Come on. So you all are having a very great ambitions when you are joined in nursing. So you want to go by yours. Yes. Yes. Anything?
Back the Java implement like the observation and the journey. अभी हम नर्सिंग स्टेशन से ही ऑब्जर्व
If you are not talking to me, can you mute yourself, or if you are talking to, because I can just hear some sound. So we can just start our session today. What about the nurse informatician? So hopefully we'll give a better idea about what exactly a nurse informatics is. So I need to share my screen now. Yes. Could you please confirm whether my screens, the content is clear, my voice is clear
Yes,
before
sir, it
starting
is
my
clear.
session?
Yes, sir.
Yes, that's great. So today we are just going to look on what the nursing informatics, what exactly it integrating, how it's integrating the knowledge, technology, evidence, and practice for a smarter clinical decision. So today, this is what exactly we are just going to think about. What exactly a nurse informatician do in a healthcare setting. Today's my objective is to understand the core principle and the definition of nurse informatics. Why I put this objective? Whenever you heard about a nurse informatics, somebody will think that he's working something related to IT. It's not exactly related to IT. Or what exactly he is working? Are they working with the computers? No. As a nurse informatician, we are not working with a computer. Are they assisting a file or EMR, electronic medical system, if there is any software issues? No, not exactly. This is from the IT, they are supporting. So what exactly the nurse informatics means, we have a clear definitions, so that we will discuss today. And what about the roles and responsibilities of an informatician? Right now, when the healthcare setting is grown up with a lot of technologies, the value of a nurse informatics, the roles and responsibility that they are seeking is also very high. Recognize the value and impact of nursing informatics here. I can just give some insight, and you can just put it in your mind when you are grown up. If you want to change a profession, there is multiple option, and one of the best option also is a nurse informatics. And demonstrate how the technology that can transform the nursing practice. We are working in the new era where a lot of technologies, where we are hearing a lot about AI, but how we can transform our nursing practice, how an informatician can help on this. Explore emerging trends in nursing informatics and their potential to revolutionize the healthcare delivery. So this is what the current trends is going on. So what exactly the nurse informatics means? There is a bigger term on that one. So nursing informatics first needs to be understood the specialty that comes under the nursing. It's a specialized field that comes under the nursing that integrate what all are the parts, nursing science, that the knowledge part, that what you are learning over here. The computer science, the technology, information science means the current technologies, and also the data, communicate data. There is a lot of data. So the data, information and knowledge and the wisdom in nursing practice. That means it's a combination of nursing science, computer science, and information system or information science to manage and communicate data, information, knowledge, and wisdom in nursing practice. So when we integrate with the knowledge, evidence, and the technology together with the data, we will get a lot of information. With that information, we can improve our nursing practice. So where a nursing informatics can support, the nursing informatics can support consumers. Why it means like the business entities. So those who are coming into the healthcare facility, about for an example, the different business entities are coming to implement the new technologies in hospital. So that we can call it as a business entities or the stakeholders. So, and also the patient, nurses, and other all providers, how a nurse informatics can help to take a proper decision or decision making in all their roles and settings. So this support is accomplished using information structure, information process, and information technology. See, this is what basically a nurse informatics is doing, or what was the definition of an informatics. That means it's a combination of science. It's a combination of science, technology, and data together, aligned together to know about the system or about the hospital to get to look on new outcomes. So once we are just going ahead, who are informatic nurse? Always, when you are just looking for a nursing informatics, skilled nursing professionals proficient in applying a nursing process. We are studying the nursing, we are studying the nursing process. So the basic skill of a nurse informatic need is they should be proficient enough to apply a nursing process in the field of nursing. So in the field of nursing care, you should be proficient in implementing the nursing process. This is the basic need, what an informatician needs. That coming with an experience. Possess strong analytical and critical thinking ability. Why it needed? Informatics, I already told about. Informatics are looking for a data. Once we are looking for a data, strong analytical data and critical thinking to find the process and to get an outcome for that process is very much needed. So the second one is the analytical and critical thinking. understand the patient care workflows, and integrate the points for automated documentations. What exactly it means? As an informatician in the hospitals, there is a different area where we need to understand the patient flows. For example, I'm just trying to implement a process in an OPD. OPD, how the patient is coming and just taking the registration or taking a walk-in, and then they are waiting in the waiting area, and then they are going to see a doctor. Doctor consult the patient. They're going back, and they are going back for some investigations or some dressings or whatever it's, and then they are going back to the pharmacy for their medication. So there is a process in between. So how this process with the technology can integrate for the better outcome of the patient. This is what exactly an informatician is looking for. Any process, how we can simplify when a new technology come over there or new EMR system plays in that one or plays in that process, how it can help in the patient outcome. And then understand the workflows and then have extensive hands-on clinical experience. How informaticians can assess this workflow or this patient journey is fine. It's through an experience in clinical experience or how to identify, oh, for example, when we are administering a medications, we are signing it in the EMR system. But after some time, for the pain medication, we need to reassess the pain. So after 30, this is all as per the policy, we need to assess the pain after 30 minutes. So after the 30 minutes, how they assess the pain. So as an informaticians, we can look into the system and we can just put an alert on the system, or we can just make an alert notification for a nurse to reassess the pain after 30 minutes. This is just an example. Utilizing and implementing the nursing process in practice. Basically, what I told, nursing care practice is one of the best, one of the primary area where we need to be looked at. Whole additional educations and experience in technology. That's one of the other for government. And the other one is the project management. Why the project management is involved? In a healthcare facility, we are having a strategy with plans, goals, and based on we are introducing many projects. So once it needs to be implemented in a healthcare setting, project management knowledge is very much essential for a nurse informaticians. Again, certifications. Once you had an experience, you can just go for a certification as a nurse informatics. There is 2 certificates currently. It's very valid throughout the world. The first one is the Health Information Management System, the CP-HIMSS, and the other one is the NIPC. NIPC is also from the American Nursing Association. So this is what informatic nurse is. So we will just look into a deep what exactly the diverse role of a nurse informatics in a healthcare field. I already told this is a specialized area where we are working in a healthcare facility. So the first role that we can say is an administrative, leadership, or management function. That means how the nurse informaticians are involved in a strategic decision making in administrative leadership and management functions by assessing or by looking on the workflows, by looking on the policies, by looking on the new evidence-based practices, data analytics and interpretations. We are moving forward with a data-driven culture. So in hospital, we are looking for the data for any improvements. So I hope you heard about the KPIs. Every healthcare facilities are having a different kind of KPIs, measurements to target to reach in this standard of level. So these key performance indicators, how they will reach. Based upon that one, they will moving forward in the healthcare facility, in the field of healthcare. So the data analytics and interpretations. As a nurse informatician, we are assessing the data. It's not a unit, it's a complete hospital based upon the KPIs, values, and we are correlating that data with the clinical practice, and we are finding out a gap in that data. So we need a many multiple disciplinary team for the improvement or for the action plans on that. So the other role is data analytics and interpretations. So now it's the data analytics and interpretations by using a dashboards. We are creating the dashboard where everyone can access and see how many patients or how many what's the rate of the infection, or what was the rate of the fall, or what was the rate of the pressure injury. These all are continuously we are assessing in the hospital for the improvement plans. IPC goals is one of the other important factor that we are be looking for. So the other one is the compliance and integrity oversight. I already explained. When we are working in a healthcare facility, it's based upon ethical data practice, standards, policies, and guidelines. As an informatician, based upon how the integrity and compliance that happened in the healthcare or in the hospital, or what was the gap, or what was the essential need that needs to be introduced newly to reduce this one. Consultation and advisory support. So when you are an informatician, you can just give an expert guidance in the workflows. I can proudly say a nurse as an informatician in the hospital can easily identify the workflows, none other than any other areas. Because when we worked in an area where we are with the patient from the start to the end, any process, for example, when the patient registered in an emergency, from that point onwards up to the discharge, the nurse involvement is there. So the nurse is always having a basic knowledge about where the patient is having a delay, where the patient is getting a delay in their care, whether the patient is happy, whether the outcome is happy, whether the patient is at risk. So each and every time a nurse is assessing for that. So again, when we will move on, the coordination, facilitations, and system integrations. This is another role. In very simple, we are having different technologies. For example, everyone knows that we are doing APGs we are doing APG. I don't know the practice that's happening in your hospitals, but APGs. Or we are having a different kind of monitors. But sometimes the nurses are entering each and every vital signs in the file or in the EMR system. So here we are just looking for the feasibility of every monitors to be directly connected with the EMR system. This is what the integrations solution technology solutions means. Because we are having a very advanced technology where we can connect the monitors with the EMR system. For example, for I want to do an APG for a patient, or I am just getting an order for APG. Once I did the APG, and then I just with the machine, when I put the sample, there is a scanner. When I scan that one, the patient details automatically identified by a system, and then the machine runs and then give the result. The practice is sometimes if the machine is not integrated with the EMR system, we are copying down the values and then we are going back and entering by manual. So where this is the area where we are looking whether this machine can give the result directly to the electronic medical system. This is what an example for the integrations or vital signs. In ICU settings, every 5 minutes we need to check the vital, and the nurses needs to enter that vitals manually in the EMR system. So what was the possibility of getting this information directly to the system? So there is a lot. If I need to say machine integration, there is a lot of machines that's advanced machines are over there. Can you please mute yourself? Thank you. And system and the process development, as I already explained, designing and implementing a tool, because now evidence-based nursing practices are very in advance. Whenever we identified a new practice or new evidence, we need to design that new system or new forms into the EMR system. What I mean, the EMR is an electronic medical record where we are entering the patient details. So when there is a new form, that needs to be designed, and that design needs to be implemented in the system. So this is how the role of a nurse informatics when they identify the new tools. Or for example, now peripheral IV, we are entering the IV lines for all the patients. Majority of patients, we are just cannulating and we are entering that cannulations, and which gauge you are using and how, and what about the assessment and daily assessment, that all you are recording. So as an informatician, what is his role or her role is to look on that one with the current evidence-based practice, and if there is any modification in that form is needed, or we found that this data to enter is irrelevant, or it's not legally right to enter this one, we need to modify. So we need to design that form, and we need to give it to the information technology team to code that one or design it in the system. This is what actually the other one, education and professional development. Now, most of the hospitals we are going with the EMR system, electronic medical record system. So as an informaticians, we can train how we need to use the system and what data needs to be entered and how it needs to be entered. And whenever there is a new tool or new live or new projects implemented, we are giving the training to a nurses or to the healthcare person to look on or how they needs to be with that new tools. Policy development. It's a very vast, this is what I told actually, nursing informatics is a very vast area where we are engaged in each areas. Policy. Whenever the quality is introducing a policy, new policy related to the patient safety or patient outcome, and that needs to be recorded in the EMR system. The first need to be identified, it's through the patient journey. What was the gap, or what is not lacking, or what the JCI recommendations, and how it's feasible. So that needs to be integrated. So now we are having a JCI 8th edition. We are having before JCI 7th edition. So when JCI updated to 8th edition, there is a lot of new updates. The vulnerable groups is taking care of vulnerable groups is very mandatory. In 8th edition, that's more highlighted in 8th edition than in the 7th edition. So how the policy needs to be changed? Once the policy changed, how the system that needs to be designed, or how the system needs to be designed for that. So these comes under the policy development and advocacy. So we are in advocacy committee where we are discussing the policy and we are thinking about, brainstorming about the policy, what can be added, what can be not added. Research and evaluations. Wherever the research is the best practice where to identify the gaps. And research is one of the other area where the informatics can look down. Do you know It's not only a nurse informatics. Nowadays, there is another position also, nurse informatics scientist. This is the other position that's very popular in US, and now it's coming more because this nursing informatics is really a new field in healthcare. It's in 1992 only this concept it came out, nursing informatics, 1992. So now in every healthcare setting, we can see a nurse informatics, those who are working for that hospital. Once we are just looking for the values, what I explained to you is a nursing informatics bilingual because we need to be, as a nurse informatician, now you got an idea what is a nurse informatics, where he is working. He is working with the patient, he is working with the patient flows, he is working with the business team, he is working with the policy, he is designing the system, he is updating new knowledge to the healthcare person. So he needs to be bilingual. So he needs to be work with the different people around in the healthcare. So, and the other one is he needs to be support the nursing process using the technology. Now, when the technology advances, that needs to be supported with the nursing work. So, nursing informatics is specifically looking for a nursing. There is a clinical informaticians, they are working for the clinicians. But nursing informatics is looking for the nursing process where we can introduce the technology to reduce the effort by doing it in manual way, re-engineering the workflows and facilitate the change management. Change managements are happening whenever we introduce anything new to the system or anything new to your specific hospitals or ward or outpatient settings that needs to be properly trained. So as a change manager, he needs to be worked on. Analyze the clinical and financial data. Did you ever heard about the revenue management cycle? In the healthcare setting, the revenue management, what the revenue the hospital is getting, it's very much important. I hope what the revenue management and all those who are be here as a seniors can be understand more about that one. But by the way, the future nurses also will go through that. So whenever there is a revenue general, revenue means it's simply we can say it's a money. So whenever the healthcare is having healthcare, whenever we are just treating a patient, the hospital needs to get that payment. It can be from the hand of the patient or it's through the insurance. This is according to the area where we are. So how they are generating this income? Is it really related with the benefit of the patient, or they are charging higher, they are charging less, or whether that outcome is getting or not? These analyses are one of the other area. We are just providing a quick reference guide for any new process where other healthcare persons can be looked on the process by doing that one as a reference or a resource. Enhancing the continuity of the case. You know, I can just give you a very good example for this continuity of care. So, what do you think about when we are at the electron, when we are just recording it in the paper, we are writing it each and every day, 1 day, 2 day, 3 in details. But when the technology EMR system upgraded, it's a more we can just say internationally the EMR systems are handled by a certain team, InterHealth teams. There is a different team over there, different software companies are there. So where we can see the patient progress in one page, where we can see where the patient is falling down with the graphical representations or whatever. We're having a workflow pages where we can see the growth. if there is any change in the vital signs, so if there is any critical values, that can be highlighted and improve the relationship with the provider and recipient of the healthcare. Cost savings and the productivity goals are one of the other key value of the informatics. What are the key components? When I introduced the topic today, I told already what are the key components in informatics. The first one is the knowledge. I can say the knowledge. Without knowledge, nothing can be possible. How we can transform a data into an actionable knowledge? The IKV. This is how we are looking for the data, and this is the data framework where we are looking and support decision making. So once we are just giving the data, once we are just giving that data to the hospital administration, they will look into the action plans. This is what DIKV means. It's a data, information, knowledge, wisdom. I already informed that in a healthcare facility now, whatever the care you are giving to the patient, the outcome measurements that we are doing, how we are assessing that outcome is through the data. What was the number of the falls that happened in the hospital? What was the rate of pressure injury? These all are the data. And this data, information, and knowledge will make our wisdom. This is the framework that support an entire hospital administration team to improve or plan for the next strategical goals. Next one is the technology. The other part of informatics component is a technology, where we are looking for the electronic health record system, where we can design, we can redesign or design new forms based upon the new evidence and practice. We can just do the designing. And this is what, once you are just looking for the system, we can see surgical safety checklist form or peri-operative checklist forms, or there is like a cannulation form. So whatever the procedure that we are doing, we need to record. So how to design that one? And CDSS means the clinical decisions. You know, now the CDSS and all, that means the clinical decision support system. What exactly that means? When I'm just entering the data of the patient, when I'm entering the data of the patient, the system will help you to take a decision. What could be the next step? Where the AI also plays a major role now in worldwide, where they will give you an options to you. From there, you can choose the better options based upon the evaluations that happen, what we are entered. Telehealth, M-health, that means, for example, the mobile health. We are having always like mobile applications. For example, I just saw Aster Health and all, there is mobile applications. So these are the area where we are having. So whatever the technology we are looking for, the real-time data access and remote access. Now evidence. Whatever we needs to be implemented in the system, that's supposed to be based on the evidence. So that evidence, if the evidence says a practice, this one is better than that one, so that needs to be changed. So how the evidence comes into action? By going for a survey or going for a research. And once the outcome and analysis came out, we will work together. The practice. I told you already, almost the primary part in the informatics is the nursing process. How the process it's going on, how it's implementing to the patient, how we can simplify with a better outcome. So for that one, we need an interdisciplinary collaboration with all the entire hospital team. So here, nursing informatics act as a leader and also as a change agent for any new implementation. So now we will just have a concept on transforming the practice to a technology. We are hearing a lot about the technology, and you know better. Technology now, the nursing is revolutionized healthcare, enhancing the patient care, improving the efficiency and support clinical decision making. So now the technology is a crucial part where it support with the patient improvement and the clinical decision making. So in that part, informatics, the field of informatics can also help in that. How? So by improving the safety and efficiency. So how an informatician can do that one? So whenever there is a new pressure injury that needs to be alerted, or if there is any fault that needs to be alerted, or if there is any critical values that needs to be alerted. This is how we can free clinicians from task. So we are working around the hospitals as a clinicians to look on the workflows, policies, procedures with the different projects where we can look the entire work. We can bring evidence. Based upon the evidence, we can change the workflows. We can change the format, how we are doing, how we are documenting. We can empower the new nurses, enable nurses to integrate data into health information and coordinate care across the settings. And when we are having an electronic system, this data can be exchanged from one hospital to another hospital. So if I'm having a file, electronic file with my data, even when when I went to another facility, they also can able to access that data and see what my previous condition is. So how the interoperability is coming is one of the other area. So I hope it's interesting. So now we will go for a future trends in the nursing informatics and their potentials to transform the healthcare delivery. So artificial intelligence and the big data. It's a very big term. Now everyone is looking for AI, but it's my very personal opinion. AI cannot replace nurses. AI cannot replace the doctors. But what AI can do, AI can help us to think more critically which action needs to be taken at first. AI can help you to choose the right, we can say the more appropriate actions that can save your patient life, that can save the time of your patient. This is how the AI. When we are dealing with the patient, the human touch and care is one of the best practice that what we have ever do. That cannot be replaced by an AI. But AI can help us, but AI cannot replace you. This is what my opinion is about the AI. So you know how the AI can help us, because in a 1,500 bedded hospital, it's very huge. You can think about the data. When we are just looking for a total 10,000 patient in a month or 1 lakh patient in a year, so we can just, it is a very big data, right? So a predictive analysis, that means this year I have 10,000 patients. In that, I have the 1, 2, 3, 4, 5 problems. So that in 2026, this might be the problem that I can face. This is how the AI and big data can help you for planning a strategic goal for healthcare. smart homes, assisting living technologies. This is what actually we are going through. We are having very smart facilities and homes and technologies, assisted living, assisted um, devices that we are connected. So this is the other one. Clinical decision support system. I already gave you an example for that. The mobile health and also augmented reality. Augmented reality is coming in place. I strongly believe the augmented reality is in place. It's more work with pediatrics that I can just see in my work areas as where the pediatric populations are very much because they are the one get more attentive with the augmented realities. How we are explaining through the mouth, it's more realized and more visuals that can be explained by augmented realities. And that can be kept in their mind. Precise and precision healthcare. That means now we are just going for the genetics, genetical analysis, predictive analysis. So what could be the next generation? So that can be an analysis on that field. Blockchain technology. The data are connected from one part to another and other part to another, and it comes together as a whole data. This is but a very small explanation. So these technologies can be worked together. The advanced data analytics. So by using the Power BIs or exchanging the data informations, we are just looking for improvement plans. So these all are the common resources that I just use, American Nurses Associations, credential centers, and HISs. So I hope actually I just explained what a nurse informatics exactly means, what was their role, and what exactly looking for. And I hope you got an idea what exactly the job roles and what was the duties, responsibilities that's looking with nurse informatics. So how beautifully you can think my future nurses. When you are growing in a nursing, there is a lot of speciality that you can just be in your mind. You can be a practitioner, you can be an informatician, or you can be an infection control specialist, whatever. There is a lot, or you can be a scientist over. So, best wishes to each and everyone. If you are in the path of future nurses, so you can just look on and keep in your mind there is a long resources and long opportunities waiting ahead for you where you can work like a lead that, and also you can just reflect your work within the healthcare organizations. Thank you so much. It's a time. If you have any doubts, you can just raise it.
Thank you so much, sir, for a inspiring and a very nice session, which is on nursing informatics. We all know that as nurses, we are working monotonously sometimes in the hospitals, but we don't know how to put that data which we have done into practice through AI. So I hope through your lecture, all student nurses and all the participants will be able to work on that and we can get some fruitful gist of your session into our nursing practice. I would request all the participants who have questions to put their questions in the chat box so that we can have one-to-one session with sir. Also, if you want to unmute, you can unmute and ask the questions.
Hello. Hello.
Yes.
Good
Yes.
afternoon, sir. Good afternoon, sir.
Good afternoon.
Uh,
Good afternoon.
I'm a tutor from Maharashtra Nursing College. I will teach the
Yeah.
student in nursing informatics. I ask you for a demonstration practical session. We will how to teach the student demonstration in nursing informatics.
Okay. I'm very glad to answer this one, the demonstration session. So you'll be working with the EMR system, right?
Yes, sir.
Yeah. How in our practice, how we are having, for the training itself, we are having a module. Because once a new nurses are joined over in the facility, we are using that training module where the system opens a patient, a demo patients where they can work. So we are having, for example, we are having in the hospitals, it can be emergency area, it can be in OT area, it can be in ambulatory service area, or it can be in inpatient area. There is different area. So we are creating a different modules for these all areas, and we are having a demo patients with the all access what the real scenario is. So where we are just giving a complete training guidelines for each newly joined nurses or transfer out nurses or transferring nurses by using a hands-on system training. I hope I answered. This is what actually I strongly believe, which based upon the software that what we are using, they can just give you an access or can give the guidance on that one. It's a separate training module for the new nurses. Great question. I hope I answered.
Any other questions?
Hello,
Come on, my fusion is yeah. Hi.
sir. Good afternoon, sir.
Good afternoon.
Yeah, Vinod Kumar from Karpagana College of Nursing, Chengalpattu, Tamil Nadu, sir. Sir, I have one question, sir. The same setting,
Yes.
how we can apply in the community health area, sir?
Yes. Yeah, the community health.
The concept in community health is.
I think the concept, yes, in the community health setting areas, as we are having like a folder settings, different folders. I think the CMC Vellore is having, or no, I'm not sure about this one, but in the community health settings where whether it's applicable in India, I'm not sure about that one, where we are having a same system that support with the community and with the iPads or with the laptops, we are just going over there and we can access. And there is a different folders for the community settings, and that also integrated with the EMR system. It's like a mobile health applications. There is an application for the community with the different folders where they are entering the data. For example, and also in the school health there is a computer system with the school health software separate where they are entering their weight, their measurements, their dental hygiene practice, their weight, everything they are entering, and there is a software for that one. Particularly, it's available in US and all. It's already there, and these data are flowing like an interoperability. It's flowing it into the EMR system. So basically, for everyone, we are having a unique ID, but based upon the area where we are, that can be changed. The locations can be changed with a different ID. But these data are flowed into that main ID. So wherever you can just trace that. This is what actually is feasible and it's already be there in the but we don't in US. I mean, in United Arab Emirates, we are having the same system with the different applications in the primary healthcare settings. But we are not going to the home facility. But in the primary health, we are having the same systems. But the data entry, everything, the system design is different. It's based upon the need of the community.
Okay. So one more doubt is this, sir.
Yes, yes.
Sir, actually, our students are basically from science groups, sir.
Yeah.
Yeah. So exactly what skills they required, sir? Except computer knowledge, what skills you are expecting for our students, sir? Like any special things, you must know about that Excel or Word, or any special things like AI merged things it's needed, like that.
No, basically there is no any special skills. Whatever they are learning, the computer skills, that's already there with them actually. How they are entering the data and how they are using the laptop. This is the basic data. But once
Yes.
the system or EMS system opens, where they are getting might be facing the difficult how it needs to be entered. For example, I'm charting like a peripheral IV. So, or if there is a signs and symptoms related to that one, when I did an assessment, there is a redness. So we are having different options. So how you need to document that one in the system? This is what they need a competency. It's not exactly a computer competency. This is what in the system about the how to use that tool competency that needs to be there. So if there is any new system or new tools, that competence, everyone can nowadays everyone can open any kind of softwares. When it's open, there is a form. But how to maintain that confidentiality? And what was the part as a student nurse, when the student nurse went to a hospital, how they can access the patient file. So they need to be basically signed a confidentiality or legal papers. And they cannot access the complete patient information in the initial period of studies. So they're having a different softwares where they can access the limited content of the patient. So this is how they needs to be, because this is based upon the area where they are going also. But how the content and whatever we are, if it's a sciences symptoms or whatever, or if it's a grading system, how it needs to be rated and how it needs to be entered, that's the important thing what they needs to be understood.
Yes, sir. Thank you. Thank you a lot, sir.
Now.
Any other questions?
From my students, there is no question.
Sir, yes, sir, we have one or two questions from our students. One question is,
So
what are...
mm.
Yes, sir.
Now I'm just really waiting to hear from my students. It's like my
So
future
we'll call
nurses.
them,
I
sir.
can
Just a
see,
sec.
I can,
We'll
I
call.
can, I can, I can, I can see an
Yes, sir, we
informatician
can call them. They'll ask
sitting
you.
in the.
Just a second.
No worries. Yeah. So I hope the technology makes it difficult for them to question and all. I believe that's the reason, or a very silent group.
No, sir, just a minute. We
And
can call them.
Hello, sir.
and hi.
Sir, I'm Abida from Kodagu Institute of Medical Sciences from
Yeah.
Karnataka.
Yeah.
So, we are actually using the same kind of thing for data entry and all in our hospital. But our nurses are not provided with monitors and all to upload, sir. But we are just uploading it in writing way only. So, like how can we believe this AI will help us in doing all this? Like, as we say that there is no moral value for AI
No. Who said that there is no moral value?
because they are AI is a computer, no sir. How can it have an emotional thing?
Okay. Then what else?
That's it. The question.
Okay. So I can just answer this one very nicely. We are just moving forward. You know, we are hearing a lot about AI. AI. Whatever we are looking nowadays, it's AI. But what exactly the AI is giving you, and how we need to utilize the AI. This is what it's important. AI, once before you are going and referring 10 books or 10 books to get a summary. But here, how AI can help? AI can look on that one, summarize that one, and give it to you. But AI cannot replace you. So whenever you have when the system advances, AI can give you suggestion. AI cannot replace you. AI can give you an option, and this is a very high in demand about the integrities, about the policies, guidelines, headlines. The worldwide, this is a big discussion. But human touch is there, human beliefs are there, but AI is helpful. Where it's helpful, not to depend on AI completely. AI can help you to think wisely which one I needs to adapt. So you told already you don't have you are entering it in the in entering the data and it's not reflected or something which is I couldn't get completely. But whenever we have a technology advancement, go through these advancements and read about these new areas where these are the opportunity where we can grow more ahead with the technology.
Okay, sir. Thank you.
Good afternoon, sir. I am a student
Yeah,
of F5 BSc Nursing, SEM 2.
yeah.
My name is Trivedi Itisha, and I have a doubt that my question, sir, is what are the role of nursing student in enhancing health informatics?
Yes. The role of a nursing and role of a student nurse. What I can just see is to understand the concept of nursing informatics. Understand because you all are having a passion where you need to be work, where you need to be grow. So the world is moving so fast. Technology is moving so fast. So when the technology advances much, technology should not push you back to stay apart from your wishes. So grow up with the technology, advancement in the technology, identify the opportunity, and work with that. And this can be where this growth, once you are learned, or once you read about, or once you're aware about, once you're curious about that one, you can work with that one. Wherever you are going, you can implement about that one. You can think much more about that. So this is how a student needs to be identified. And other thing, the student's role is whenever you are using electronic or technology, how the patient safety is, how the information safety is. So that regulations, the patient informations and patient safety regulations, how I need to maintain, that's very much important. Every student needs to understand about the consequences or about the criticality of using the patient information. Nowadays, we are using the technology. Everyone is holding the mobile. So you cannot take a patient information by using a mobile. So these are the basic informations that needs to be embedded with your studies. Thank you.
Thank you, sir, and thank you for this amazing session, sir.
So, any other questions from the participants? So, I have one more student. One more question.
Good afternoon, sir.
Good afternoon.
Myself, Keyur Patel. I am also a student of first year BSc Nursing from KD Institute.
Yeah.
I
From which
have
year?
first year.
Okay, great.
Uh, the time required for the entering the data of any patient on electrical devices, can we utilize the same time in improving the condition of other patient, or and how beneficial it is for the nurses and other healthcare professions to enter the data in the electronic devices?
Can you clarify the question more? Actually, you mean that the data entry of the patient information,
Yes.
how it's beneficial? What do you mean?
Yes. How is beneficial, or can we minimize the data in entering on the device and focus more on treating the patient?
Okay, if I understand your question, like this is the role what we are playing. So how we can minimize and without affecting the patient safety. So some documents are required for the legal purpose, or some patient information that cannot be voided from the system. But how it can be designed, how it can be more feasible as a nurse to enter it in the electronic system, this is the where the informatic roles comes. And about the integrations. Yes, sure. How these all will help. When the technology comes out, new when you are in the ICU, more than 7 monitors are connected with the patient. For example, 7 monitors. All the values you enter manually in the system. Is it really good for you to be entered 5 minutes values in the system? Is it good? No, it's really not good because I'm just working in intensive care. So how the system can integrate with the EMR system to give values directly to the electronic medical system. This is how our roles are coming, whether the softwares that are dealing or the machines, whether there is an interoperability. That means the data is whether we can transfer it from this one to that one, or which one was a new technology that can replace this monitor and bring another monitor to integrate with the EMR system. This is how informatic role, how beautiful the role of a nurse informatics. Am I right?
Yes. Yes.
Yes. Best
Thank you so
wishes. Yeah.
Thank you so much, Mr. Thomas. You have covered almost every aspect, and we got this. We can see the participants are still 100. We had 100 capacity of Zoom, and they are still present here. That shows the enthusiasm and the way you have captured their attention, and it was really encouraging. And even you can see the YouTube also. We are getting good response, and hope this kind of like alignment of academic and clinical practice. Definitely, it will make a big change in Indian scenario. We have nurse informatics specialist in few hospitals, but it is not widely spread in big hospitals. Soon, I think Indian hospital system, the corporate system, they will definitely give a position for such a nurse who can definitely work or spend their complete time for this nurse informatics. Thank you so much, Thomas sir, for giving us valuable session. Yes, thank you.
Excuse me, sir.
Thank you so much.
Uh,
Yeah, thank you
One
so
or
much.
two students have some questions. One,
Yeah.
so I request you. Okay.
Good afternoon, sir.
Hi, good
I'm
afternoon.
Shruti Patel from FIBSc Nursing.
Yeah.
And my doubt was about the privacy of the data of the patient. Like, what if the data gets leaked? How can we cover that? And if private data of the patient is leaked, so that's not a good point, I think. So it will be better if something can be, in exchange of that, or AI can be updated, something like that.
You know, the healthcare softwares are built based upon the securities. Because in US, when we will think about the US, we will just say an HIPAA Act, where there is a different policies that are already be in place to avoid these kind of data leakage. Okay, And how we can prevent this one? When a new employee, because we already have a system software in place, data security, and because this is not an open platform for everyone. For example, for you, when you are working, when you start working in a hospital, you will get an ID with a password. You have to create your password, and where you can access patient information by using that ID. And what was the healthy software is doing? It's up to a location captures. There is a lot of features, but for basic interest, I have to say, it's if you are taking because you cannot even open that one when you are in the when out of hospitals, because by using the premises Wi-Fi's, only you can access the patient data. Once you are out from that one, you cannot open that. This is how the privacy is made. And again, your logins, your signing offs are monitored completely. And we have and policies and guidelines in place with an orientations once you joined in a healthcare facility about the data security and management. This is how we can control these kind of data leakage. Some leakage, because and also in US, if because for the healthcare in US, if there is a data, any leakage in the data itself, it's like it will be a legal implication needs to be looked up. So this is how we are creating the software securities, and you are having your own passwords, you are having your own IDs, your own locality. Only you can open. Different restrictions are already in place to prevent that one. Great.
Sir, but it's necessary to, verify if the ID and password is given to an employee. So is that employee have good intention or not? What if that employee has some other intention and the employee itself leaks the data?
Yeah, this is a very nice question. Yeah, employee can leave. This is how we are monitoring the accounts. These accounts are monitored, and once the data is going out, also the system itself can be identified whether it's leaked or not, or where it logged in. Because, for example, I'm having a server system, and the server system I'm having an ID. But if I just generated data or sent it to something, because these movements can be captured. And first of all, once you are signing the job descriptions, every data integrity, data management, data security, everything is already in place, and you are signing a bond. So based upon that bond, you have to be maintained the patient privacies. If there is a bridging, apart from that one, there is a disciplinary committee, protocols, actions are in place in every facilities. It's like in a way of very understanding. This is a risk where information management system it's looking for that. Like health information management system, it's basically looking for the data, patient patient privacy, patient information, patient data. If there is any breach in that one, that can be recognizable and that can be in action.
Thank you so much, sir. And it was a very interactive and good session. And thank you for the
Great.
session, sir.
Great.
Good afternoon, sir.
Good afternoon.
Yes, so on behalf of the first year BSc Nursing Sciences students, so I thank you for this session, and it was very, very informative for us, and it was very good, grateful for the nursing information knowledge and our class. Also, we put effort on the nursing informative in technology and also the in this area. So thank you so much, sir,
Great.
for giving this session and your time. Thank you so much, sir.
Yeah. You don't have question? Great, great. Okay. Thank you so much. I really appreciate.
Thank you so much, sir, for this enlightening session. Thanks to all participants who have been patiently listening and asking questions. It is indeed a very helpful session for us also as teachers. Thank you so much, sir.
And once again, thank you so much. Thank you, Dr. Chris, and thank you all the professors, doctors, and everyone else who joined. I hope we will meet you again soon. Thank you.
Feedback link will be shared in the WhatsApp group. So I request all the participants to kindly fill the feedback form. Thank you, everyone.